Hey guys, I am Christina Fenstermaker.
I'm Lucinda, and today we'll be focusing on the NADEC Module 2 Evaluation Individual Treatment Plan, which focuses on treatment planning in addiction counseling. We will explain how counselors assess clients, determine appropriate care, and develop treatment plans that address the whole person, not just the substance use. Evaluation is the first step when someone comes to an addiction treatment program. The counselor's goal is to understand what the client is experiencing and what kind of help they need. This process also helps build trust and rapport, which is important because clients may feel nervous, ashamed, or overwhelmed when seeking treatment. Screening and assessment are related but different processes. Screening is brief and happens first. It helps determine whether the client is appropriate for a specific program. Assessment happens after admission and is much more detailed. Together, these processes guide diagnosis, treatment, planning, and level of care diagnosis. The purpose of screening is to make sure the client is in the right place. It helps counselors identify whether the program can meet the client's needs or a referral is necessary. Screening process protects client safety and ensures they receive the most appropriate care for their situation. And then this is the assessment process. Once the client is accepted into treatment, the assessment process begins. This involves gathering detailed information about the client's substance use, personal history, and current challenges. The assessment helps the counselor understand what contributed to the substance use and what areas need to be addressed in treatment. During assessment, counselors collect information about substance use patterns, physical health, mental and emotional functioning, family relationships, legal issues, and social environment. Counselors also identify client strengths and support systems, which are important for building an effective treatment plan. The ASAM criteria is standardized framework used to determine the appropriate level of care for a client. It helps counselors make ethical and consistent decisions about treatment placement. ASAM supports a holistic approach by looking at multiple areas of the client's life, not just substance use. So the six ASAM dimensions. They evaluate clients' needs. Like these dimensions look at withdrawal risk, physical health, mental health, and emotional conditions. Also readiness to change, relapse potential, and the client's living environment. Together, these dimensions guide treatment intensity and placement. Now we're going to look at the biopsychosocial model, which explains that addiction is influenced by biological, psychological, and social factors. Biological factors include genetics and brain chemistry. Psychological factors include thoughts and emotions, and social factors include relationships and environment. Effective treatment must address all these three areas.
Perfect. Okay, so the next we are going to talk about individualized treatment planning. So after assessment, the counselor and client work together to create an individual treatment plan. This collaborative approach helps the client feel involved and motivated in the treatment plan. The plan is based on the client's specific needs, goals, their strengths, and it can be changed as the client progresses as well too. The key components to the treatment plan, which we tried to make bigger, but if you want to, you can just Google what the personal treatment plan looks like. But a treatment plan includes identified needs, clear goals, measurable objectives, and specific interventions for the client. These components help guide the counselor's progress and provide structure for the client. The treatment plans are reviewed regularly and to ensure that they continue to meet their clients' needs, as well as, again, you can after viewing them, or you can always change them later on if needed. Why treatment planning matters. Treatment planning, it's an important part because it does keep care organized and focused on the client. It does ensure the counselor addresses the whole person rather than just the substance use. A well-designed treatment plan supports progress, accountability, and long-term recovery for the client. And moving on to our case study. So our case study focuses on Dakota, who's a 34-year-old Indigenous male who lives with his wife and 2 younger children in a Native American community. Dakota works full-time as a warehouse supervisor, but was referred for a substance use evaluation due to concerns raised by both his family and his employer. So Dakota reports daily peyote use, which he identifies as part of his spiritual and cultural beliefs. Historically, his peyote use began in ceremonial settings at the age of 19. However, over the past 3 years, he has increased significantly in his peyote use and now occurs daily, both at home and at work. So despite clear consequences such as declining job performance, absenteeism, safety concerns, emotional withdrawal, and just the strain on his family relationships with his wife and kids, Dakota does not view his substance use as problematic. He attributes these issues to stress and feeling overwhelmed rather than his peyote use. So from a biopsychosocial perspective, Dakota shows impairment across biological, psychological, social, and also spiritual domains. His spirituality is both a strength and a barrier, as it does provide meaning and identifying while also reinforcing denial and resistance to change. Dakota is currently in the pre-contemplation stage, meaning he does not yet recognize the need for change, which significantly impacts treatment planning and the level of care for his decision. The next slide is our DSM and our Z codes. So, of course, the DSM diagnosis is other hallucinogens use disorder, so peyote. He does have a moderate use for that. Our Z codes that we included for the case study is Z56.9, and that's for occupational problems, which is work-related stress or difficulty affecting his well-being. And then the Z code Z63.0 is for relationship distress with spouse, which means that he, of course, is showing ongoing conflict or stress in a marital or a partner relationship. And then the Z60.3, which is the articulation difficulty or cultural conflict, which does play a really big role in his substance use, which is stress related to cultural adjustment or conflicting cultural values. Also in this one, we did talk about what screeners that we did as well. So for instance, he scored a 4 for his ASAM, which is significant exposure to childhood adversity and is associated with increased risk of substance use disorder, managing his emotional regulations and lack of coping skills as an adulthood. And then his Holmes Ray, he did score 178, which places Dakota in between the 150 and 300 range, indicating a moderate to high level of stress. He is at risk of stress-related health or behavioral patterns. This level of stress will increase a continuous level of substance use. His assist was at a 32, and then going to the OQ45, which he did score a 94. Scoring the 94 reflects clinically significant distress. A score of 94 suggests that he His intentional symptom distress is acute, even if Dakota minimizes it during his face-to-face. And the readiness to change, again, as we already addressed, that he is in the pre-contemplation stage. For our treatment plan, this slide, it just summarizes Dakota's individual treatment plan based on the DSM-5 criteria. He meets diagnostic criteria for other hallucinogens use disorder, moderate, due to this continued peyote use despite occupational, relational, and safety-related consequences. So based on the ASAM assessment, Dakota is placed at a 3.5 level of care, which provides a structured, high-intensity residential setting appropriate for his low readiness to change and ongoing substance use. Treatment goals focus on increasing insight, reducing reliance on peyote as a coping strategy, and improving overall functioning in family and work roles. Cognitive behavioral therapy is what we selected for would be the best for his treatment plan. It is a primary intervention and will be delivered in a culturally responsive and trauma-informed manner. CBT is used to help Dakota examine the disconnect between his spiritual beliefs and the real-world consequences of a substance use without invalidating his cultural and spiritual belief, which is a really big thing. The goal for the treatment is to support recovery while helping Dakota develop healthier, non-substance-based coping and spiritual practices.
And that is all for our presentation for today. We recommend watching the movie In Waves and War, which illustrates the complexity of healing when trauma, spirituality, and non-traditional practices intersect with clinical treatment. The film highlights how alternative healing practices may offer meaning and connection for some individuals, while also raising important ethical questions about clinical responsibility and evidence-based care. So again, that's all we have for today. We would like your input with the discussion questions. They'll be also attached to the discussion board in case you guys can't see this. Have a good night, you guys.
Bye, guys.